We have had some what we call landmark studies in diabetes, but we've had no landmark studies in diabetes in older people, so no large-scale intervention studies, only using data, what we call extrapolated evidence of benefit for glucose lowering. And certainly no major studies looking at the effects of glucose lowering or improved diabetes care within institutional settings. And some of the new kids on the block in terms of the treatment of diabetes, the DPP-4 inhibitors, the GLP-1 agonists, there are no data for the use of these drugs that now have a fairly wide license to be given in people with type 2 diabetes. We have very little evidence that they can have efficacious effects in older people. So the guidelines that you have a copy of, I commend these to you. We came to a number of important conclusions when the guidelines were developed. This is work that's been going on for nearly a decade, but they are evidence-based as much as we can. The guidance is very comprehensive. We give practical guidance in many areas which we think will aid clinicians to enhance the quality of clinical decision making. And what's very pleasing to us, the authors of the guidance, is that some of the targets that we made in relation to, for example, the range of glucose values that should be aimed for in managing people with diabetes, these have been referenced and have now been included in other international guidelines. And that is, we feel, an achievement. And in many ways, when we got together another group of individuals, many of these representing the International Association of Geriatrics and Gerontology. This is the global organization that manages the science and the medicine of older people in the world in terms of bringing together the professionals involved in that care. When we involved them, we wanted to say, well, let's look at these guidelines, let's reflect on their meaning and perhaps start to dissect out those areas such as glucose targets, hypoglycemia, the influence of comorbidities and so on, to see if we can provide some additional practical advice. And we think we have done that. But you know, a very other important aim of guidelines is not just to make recommendations to clinicians on how to manage people with that particular disorder, disease. It is to identify gaps in research